Hola, Dean Clem.
Doing well. How about you? How was your sabbatical?
So stellar.
Oh, good. You have to let us know what you did.
I walked the Camino. I walked 550 miles in 58 days.
Is that the one in Spain?
Yeah, it was awesome.
Yeah. So the Compostela path.
Exactly.
Wow. It's amazing.
It was so.
Yeah, if you remember Estelle Codier, she did that too here in our department.
Pretty cool. Hey, you Rose.
You guys are tiny.
We do have one community guest today. Jody Chi is joining us from Nancy Hemisphere School of Nursing. So if you want to do the roll call.
So they do roll call.
Okay.
So can I just look at the
Here's
screen?
one. Yeah.
Okay, so I'm gonna do the formal roll call, okay? Jeanette,
Here, present.
I'm doing it by the screen, so nobody move. Carrie, you look here.
I am indeed.
Rose Hada.
Present.
Catherine Finn Davis the Great.
I'm here, aloha.
And Dean Seriula. So wonderful.
Here.
Aloha Renee.
Hello.
Arthur rocks too. Hello, Hilo.
Present.
All right. And Brianne is right close. Gloria, how are you? Are you driving in traffic right now?
How did you know? Yes, I am, but I am here.
All right. Well, be careful. Pay attention to the road. Just use your ears. And then Jody. Aloha, Jody.
Hi.
Clem, is this your new main helper?
Yeah, so Jody Chi is the dean's executive assistant.
Super cool. Congratulations.
Yeah. And she wanted to know more about Hawaii State Center for Nursing and how we're connected. So I think that's such a great intention. So thank you, Judy.
All right, well, I think that's everyone. And then here is Linda is here from ANA, and I am Ann, and I am here from the lovely Valley Isle. And of course, our fearless leader, Laura. Hello. So with that very formal start, I better read the public comment statement so we're all straight and narrow. Individuals who are unable to provide testimony at this time will be allowed an opportunity to testify when specific agenda items are called. For both internet and phone access, when testifying, you will be asked to identify yourself and the organization, if any, that you represent. Each testifier will be limited to 5 minutes of testimony per agenda item. All written testimony submitted are public documents. So all my smart remarks are publicly available. Therefore, any testimony that is submitted orally or in writing, electronically, or in person for use in the public meeting process is public information and will be posted on the board's website. So welcome. So the first person off the deck is Dr. Oliveira, telling us the coolest stuff that she knows.
So give a pretty comprehensive update at our strategic planning meeting in August. So I don't have too much to say beyond that, except that since then we did release our statewide data tables by license. So this is available as a PDF and an Excel file at the request of boss, who prefers them as an Excel file. So basically it takes almost every variable on the survey with the exception of the secondary employment characteristics and tabulates them by license. So you'll be able to see the distribution for pretty much every variable that we took information for. So there's no crosstabs in here. The crosstabs will appear in the statewide report, which will be out by the end of this year. The cross tabulations, there will be a couple by setting because those are really interesting. We see a lot of variations and differences on certain variables in the workforce by setting, but the big cross tabulation in the report will be by county. So there's going to be that county breakdown because we have enough data to be able to do that this year. So the other thing that came out in conjunction with the data tables always is the method. So the data collection methodology there, including sample sizes and response rates and margins of error for each license, is all there. So that's what's available right now. So take a look at those. Any questions?
Linda?
Cool beans.
Hi, Carrie. I have two questions.
Who am I looking at? Is that Linda?
Yes.
Okay.
Linda Beach North, Hawaii ANA, advisory board today.
Correct.
I wondered if you were going to do some beautiful graphs for publication.
Yes, so we're going to have infographics out. I talked to Leanne about that just earlier. What day is it? Today's Tuesday, end of last week. She and I had a conversation about that. So what she's going to be working on while I'm finishing up the ed capacity for this year, because data came in late for that one. And then when I'm working on the supply report, she'll be working on the infographics. So the three she's going to start with are the kind of major characteristics by license. So we'll do an LPN, an RN, and an APRN infographic, and those will come out first. So highlighting key characteristics of those workforces.
Thank you so much. It's beautiful.
You betcha.
And we do want to publish it. Second question, at some meeting, and I can't remember in what context this was, we talked about maybe doing some focus groups to follow up after the data came out. And I wondered if there was any news about that.
Not specifically, but I was having a kind of a conversation with Arthur about this, like wanting to be like out and communicating with people. So Arthur posed the question to me at our simulation conference, which I'll also provide an update about. So can we get the response rate up? We did have the biggest response in the history of the supply survey. So we had 15,000, almost 16,000 responses. After data cleaning, it was closer to 15.4, I think it was. But it's still about a 49% response rate. So we can do better. So one of the things we were talking about doing was like, where we know we are not tapping into is nurses who are working in settings outside of hospitals. There's a lot of advertising for the supply survey in hospital settings. Employers have resources for that. So part of it is about like showing my face in settings, making connections to the DONs and the staff nurses in those areas, and sort of in conjunction with that, asking the question of those nurses, since we're in that environment, what can we do? How can we support you, or whatever else? So we don't have sort of like amorphous plans in my head for that, but going down the road, I do think that that's an important priority for us to be pursuing a bigger response rate on the survey, tapping into those settings that we don't customarily get, and then to answer some questions that the survey is not good at getting answers to.
Great. And please keep in mind that Hawaii ANA would like to work with you on that.
Noted. Thank you, ma'am. Any other questions?
Thank you very much.
Cool. Thanks. See you.
Stellar, thanks so much, Carrie. I know that's a lot of big work, and you haul a lot of people along too to help that. So thanks. Why don't you just go right into the sim huddle?
Will do. This was an adventure. It turned out really well. So sim huddle happened in, oh yes, October 17th. Thank you for the dates, because I don't remember when it happened. This started so Leanne and I were kicking around the idea of trying to respond to the needs of our simulation collaborative that the Center for Nursing runs. Mostly it's an informal group of people who talk about sim stuff, and us trying to figure out what it is we could do to support them. Everybody said that they wanted a conference, especially post-pandemic. They wanted to sit in a room with their colleagues and talk, and then hear from experts. So we had the intention to put on a conference. We got some funding from the Department of Labor and Industrial Relations Health Workforce Development Council. And subsequent to that, we were contacted by the California Simulation Alliance and the Victorian Simulation Alliance, who were already planning a separate conference to be held in Waikiki around about the same time that we were putting ours on. So in the interest of combining resources and putting on it what is essentially turned into an international conference, we were one of three sponsors for Sim Huddle. So we ended up bringing out some folks. The feedback that we got from the local folks who attended were like, "Oh, you guys brought out really great speakers." So we brought out Adam Chang from Canada, who's like apparently a big deal. That was the one request. We were going to bring him out anyway, but we also brought out Michelle Abersold, who's like doing a lot of augmented and virtual reality. There were a lot of mannequins and disembodied parts. Was very unsettling to me, but people seem to have a really good time. So it was 2 days, 1 day and a half of actual conference, and then some pre-conference activities, and we got really good feedback. So we hope that we did something good for our simulation collaborative folks. Our intention is to have a meeting with them. We have meetings scheduled. We have 2 alternate times to make sure we capture everybody, but to kind of debrief. So what did they learn? What did they get out of that? And then how can we sort of like lean into the momentum of Sim Huddle? And like, are there people you want to hear from again? Do we want to do another conference going forward? What can we do? Who do you want us to connect with based on the conference? So trying as much as possible to just kind of move forward on that. So we were really lucky to get a lot of sponsorships and especially the money from DLR. So in the end of the day, I think we put on a good event.
And I'll add if I can, well, one, Carrie did not only is Carrie a good conference planner, but and she and Leanne make a great team. She's a great MC for events. You can imagine. Was the de facto MC, and everybody did all the things that they were told, so that was good. But then we also, because of the nurse residency program grant, and because of the grant that Carrie and Leanne got, we're able to contribute pretty significantly to Neighbor Island participation, both by supporting their travel and their registration. And so I think that also really was being able to leverage state resources. There were 2 different state grants that were used, as well as some Center for Nursing resources that really helped with that Neighbor Island participation. And it was really nice to see those faces present. I think that's really important.
You know,
Carrie, we had
There were, I want to say there was like 112 total people registered, but that included all the sponsors. I think when it came down to eliminate them, it was about 100 people. I would say, I don't know off the top of my head, close to half of them were local, I would estimate. So
not half of them supported by the Center for Nursing, but half
no,
of
right. Yeah, but local attendees, and I don't know, but probably half of those were supported in some way, shape, or form by Center for Nursing or one of our grants. So yeah, it was cool. Good event. So thank you for everybody who attended or supported or facilitated putting the event on. So thank you very much.
super good. All right, Catherine, can you debrief the EBP?
Sure. So aloha, everyone. 'Tis the season for conferences out of the state center. So we had another conference or workshop on November 3rd, and this was a deep dive into Johns Hopkins evidence-based practice tools. The center has adopted the Johns Hopkins model and tools to be used across the state. Most of our healthcare organizations and schools have followed that lead. So, and many of the requests that I was getting and folks were asking about how to use the tools specifically. So they can be a little daunting if you're not familiar with them. So we decided to bring out Johns Hopkins because it's a lot more affordable to do that than sending a bunch of people to them. And so Kim Bissett and Denise Vera came out to visit us, and they did a one-day workshop. We had a total of 79 attendees. We actually filled up before the deadline, and we had people on a wait list. So I hate people that had to be waitlisted, but it's a good sign that we got full. We had 8 total organizations that were represented. By far, the Queens Medical Center sent the most. They sent almost 50 folks. So I patted myself on the back and said I did a great job talking it up at Queens. So they were great. We also had a good showing from Tripler, Army Medical Center, so that was nice to interact with those folks as well. From our academic facilities, we had folks from Chaminade and Manoa, UHM Manoa, UH Manoa. And we had 3 counties represented, Honolulu, Kauai, and Hawaii. And we were able to provide some travel assistance for those folks as well. So we were excited to get them over here. And like Carrie said, there's nothing like being in person and getting to collaborate and chat and get to know each other better. So the evaluation data was really good. Folks appreciated it. This was a very hands-on workshop. I kept telling people, you're not coming here to sit in a chair and listen, you're coming here to sit and work. So they did great at that. They appreciated it. And the only negative feedback or constructive feedback that we got was that it was a lot packed into one day, which we recognize, but we're always trying to kind of meet the needs, you know, and if we do a 2-day conference, we get feedback that it might be too long, too many days to get out of work, and then you do a 1-day conference, it's too much. So we're trying to find that kind of sweet spot for everybody to meet their needs. So I want to give a shout out to Leanne Hussey, who's not here, but is here in spirit. I could not do these conferences and workshops without her. She's amazing. And thank you to Carrie for helping us on the day of. And I should have grabbed you for all the MC parts. I did not know that you had that skill, so I will grab you next time. But thank you. Any questions?
Sounds great. No one from Maui, sad to hear.
No, and we reached out specifically to Maui College and Maui Memorial, and they were not able to participate at this time. So, but we wanted to make sure that they were personally invited and offered any kind of travel assistance, but it just wasn't a good time.
Captain, it's Gloria. I was kind of wondering if you could provide some insight as to, you did mention the larger organizations that attended, as to maybe, and I'm not sure if you even have the answer, about possible reasons that maybe no or low attendance from smaller organizations, maybe FQHCs, governmental programs and things like that. Any insight to that?
Well, usually with the smaller organizations, it's harder for people to get a day off because they're, you know, part of the mix and part of the, you know, crucial staffing. It's harder to reach those smaller organizations as well in terms of marketing. We do have our emails and our listservs. So I would think at this point, probably every nurse in Hawaii might be on those. And so we are always looking to improve our, you know, advertising and recruiting for these events. And I know, I mean, and even the larger organizations, you know, some of those we had nobody from. And so again, that tells me a little bit about organizations' engagement in evidence-based practice. I know Queens is very engaged and very supportive of evidence-based practice, whereas some of the other organizations, that culture is just not as robust. So that's my take on that.
Thank you. And my reason for actually asking this is that I know that when I was going through my DMP process, I actually used Johns Hopkins EVP to for my process to go through my doctoral program. But others, when I was in school at that time, they were doing theirs at FQHCs and stuff like that. So it wasn't really large entities, but we reached out to the smaller entities to be able to do that. Shucks, it would have been great to have more smaller entities participate in that. Thank you for sharing.
Right. And we tried, and I think we did a good job of making it very affordable. So hopefully the cost was not a barrier. So we offered the travel assistance for the neighbor islands. And you can see on the flyer, $150 if you did early bird. So that, and they got 6.5 CEs with that as well. So at the center, we're always trying to make everything more accessible. So I think we did a really good job. So hopefully that was, I mean, I'm sure, money and funds to go could be an issue. Time off and funds to go can always play in there. But thank you for bringing that up. I think next time we can do more of a concerted effort to reach out to the smaller organizations. And yeah, I think we could probably think about that a little more strategically. So thank you.
I'll
Thank
add,
you.
Gloria, that we do see a wider breadth of nurses, representing different settings for our like 1 hour CEs. So, I mean, it's just more accessible, the timeliness. And I know that and then the amount of work that EVP requires, I think people imagine that it's this huge mountain instead of trying to learn more and find ways to make it accessible, which these workshops aim to do, help people be able to use it. And that's a lot of the work that Catherine's been trying to figure out, is like how to work along that continuum. She's done a lot of investigation with the partners over the past 2 years. But I just want to, in terms of our learning engagement strategies, our CE webinars do have a broad engagement. So maybe we can also, as data for you, Catherine, we can look at the settings and what kinds of activities people are choosing. I think we do have that data. We can kind of look at that in some ways.
Okay, sounds good.
We can bring more information to you.
Thanks.
Thank you.
Good. Thanks, you guys. Let's turn it over to
Can I just
Bree.
add one thing?
Yeah.
Yeah, so I want to just thank you, Catherine, because what really helped in us sending about 50 people for this is not just advertising it, but really the strategic planning piece of it. Like, what plan do we have at the organization? What are we going to do? Like, what are we going to do with this information? So it was helpful to have more like, have that strategic plan about EVP at the organization, then leverage this with a budget. So otherwise, I don't think we would have, it would just be onesie, twosies people who are just interested in going versus having like a big group being supported to go. So thank you for working with us.
Oh, absolutely. Thank you.
Good point. Okay, now we go to Bree.
Okay, so similar to Carrie, we did some pretty exhaustive updates on all of our programs during the summer session. So I'm going to try not to reiterate any of that and just kind of like bring you up to speed on where we are. We've had a lot of movement towards some of our goals that we talked about during that time. So we have officially, as of today, signed the extension on the opioid training grant for the next year. We came back. We had it in writing in the gentleman's agreement. We just didn't have the fully executed bits and pieces. But what that does is that provides us with the continued funding for the next year through to the end of September of 2024 to continue paying for our nurse residency program and our preceptor pathway programs for all of our participating partners who are providing opioid training through those training programs. So being able to cover that at 100% is quite a big deal. And what we do have along with that, though, is that in addition to being able to do those things, we're able to do some additional activities with those monies to help with the professional development of a lot of our partners. So as Carrie indicated earlier, we were able to provide some travel support for folks that were going to be attending the simulation huddle because of its relationship to clinical education. So it was a really good way for us to be able to spend money. We're also using some of that money to help support same kinds of things with our transition to practice conference that we're going to be holding next year, which is exciting. So overall, it's just pretty amazing. We're hoping to be able to pay during the last period, we were able to pay 100%. So the first period, we paid 88% of the direct costs. For this last period that just closed, we were able to cover 100% of the direct costs of everything that was reported to us from our partners. And this next year, because we also have Good Jobs Fund, I anticipate being able to cover 100% of the nurse residency program and preceptor pathway costs.
Well, like how many people does that represent?
That, since the program started, that represents 915 trained nurses. But that's including preceptors. But we have, it's actually quite amazing.
2021.
Yeah. So since we've had that grant, so we've exponentially increased, and that'll be present in the annual report. And I didn't think to put a lot of those kind of full details in here, but essentially what we've been able to do is really expand those programs in our rural communities. So we've increased that by 30%. I mean, essentially, that's just overwhelmingly amazing, something that they should be so very proud of. So as we talked about during the summertime, we also have the transition to specialty training grant, which is held under Good Jobs. We are working with the University of Hawaii Community Colleges, specifically with Maui Community College, in order to be able to provide those resources through the center to our partners. Essentially what that does is it allows us to cover the expenses for curriculum and enrollment in transition to specialty training packages, which can tend to be quite expensive for our clinical partners to provide, which is in some way part of the limiting factor of our clinical facilities on providing that education to our partners. So it's pretty exciting overall with this grant. We're hoping to train 845 employer-based transition to specialty nurses in courses. So, I mean, that's our goal. I hope that we can get somewhere close to that target.
In 1 year?
Well, it is. So part of this is that in addition to being able to secure this grant, we went to bat to ask if we could do it because it took a very long time, a lot of conversation, and a long time of getting the parts moving, which only happened last month, the final phases of it. But we had petitioned to ask for retroactive reimbursements to our partners, and they're allowing that to happen. So they gave us from January of 2023. So all our partners have to do is report to us those enrollments, and we'll be able to make a reimbursement based on the grant rate. And so while it isn't going to help augment the cost of their operating expenses or human resources, some of those curriculum packages can be upwards of $900. And so having that offset will make a substantial difference. And of that, there are 45 different training courses that are offered under that grant in 25 different specialties. So I've provided a list here in the slides, which everyone will get. It's pretty exhaustive. We based all of the details of what was going to be covered on the HAH report from 2022. In addition to surveys that were conducted among our clinical partners of what they were offering and what they needed or what their needs were. So between those two sources, that started the list of what was going to be provided. And as we've gone through the process, we've had partners request specific additions to the curriculum to be added to the list. And we've also added things that were not requested and not on the report, but we believe may be positive and a good idea, such as some wellness services, so that we can look at providing some additional care for individuals, and that's provided by Psych Hub, and so far the comments have been quite good. You'll notice in this other column here, and this is kind of the most important one, and I'm going to sum up my section and let you guys go. You see in the column over here on the right hand side, it says HAH stipend. So HAH is also providing and managing and facilitating the funds under the Good Job Grant to provide stipends to facilities for preceptor mentor activities for them to use to either pay towards their preceptors or to offset the cost of having preceptors not spending time directly providing patient care, with the idea that there's a slight reduction. So in order to speed things up and make things a little bit easier for all of our partners, we are working with HAH to facilitate the data collection for the stipends through our reporting of the curriculum courses, because there's a direct correlate. So that should help make things a little bit easier for our partners to not have to report to another agency. They're going to receive their checks from HAH, not from us, but at least they're not going to be asked to provide yet another report. Part of what's really exciting under that Good Jobs Grant is, in addition to the incumbent and also some of those transition to specialty courses are being used in new graduate programs, we are able to also cover the long-term care post-acute residency program. So that residency program that was designed in collaboration with HealthStream to make it accessible for our long-term care facilities, with the acknowledgement that those facilities operate with a reduced human resources necessary to provide the same kind of programs that acute care facilities can. So knowing that it would need to be able to be provided in an entirely virtual way, we were able to launch this pilot this year, just getting it off the ground. We have 2 partners that are currently on board to launch this pilot. They're both going to be launching their first residencies this fall, so before the close of the year. What's really exciting is that we get to see how that's going to work out for them. One of our partners is really, really gung-ho, and I'm really excited about getting all the nuts and bolts of that from them. So we've got one partner launching at 12 months and another partner launching at 3 months, abbreviated 6 months. So what that means is they're going to pack it all in 3 months, but then provide continued support for 6 months of education for free. Part of that also was working with the content provider to establish a long-term mechanism for maximizing cost savings for all of this curriculum package. So what we've done is work with them to help create a marketplace where everyone across the state can sign up for these courses going forward and receive bulk pricing based on all of the facilities working together. Right now we're covering it all 100%, but essentially what that means going forward is if we're combining all of our buying power, hopefully it means that we're going to be continuing to get the best rate possible going forward. Once we're out of grant funds, that it should still be a cost-effective venture. I'm super excited. I have 1 more minute left. I'm super excited to introduce Ajay Patel. He is a graduate assistant that is working with me on the nurse residency and transition to practice programs, specifically on the grants portion of this. Really excited to have him. He received his bachelor in biology from Santa Barbara, and he is a recent graduate of the Gavin program at Nelson. And he just sat for NCLEX like two weeks ago.
A month ago now.
A month ago, okay. Yeah, so it's very exciting. I'm very excited to have the help because there are a lot of moving parts with this, and excited that he's on board with us. And hopefully he has a good experience while he's here. And you'll see that my slide explains TBD here, conference information. We have established a subcommittee to plan the transition to practice conference, which will be focusing on all areas of our transition to practice program. So that includes nurse residency program, specialty, curriculum and our long-term care post-acute so we can maximize everybody's collaborative activities. We are looking at April of 2024. I can't provide more information than that at this time because our committee will be making some pretty tough decisions on Friday, but I can provide a fall update on how those things are going by email. And thank you, Arthur, and your team for participating in that planning team.
That's awesome. Right, Laura.
All right, well, it's been, the legislative session usually lasts from the third Wednesday in January to the first Thursday in May, and this year the legislative tasks have just really, they're still happening. So there's a lot going on with the, in terms of nursing policy in our state. This is because we're in a nursing shortage, and so we ought to do something about it. The Center for Nursing, because our task is to do research and ensure quality practices and best outcomes, and then also develop strategies for recruitment and retention and report outcomes. Strategies to support recruitment and retention should be evidence-based, and they often will include policy recommendations. So that's why we do this. It's our job as the Center for Nursing to make sure that the state has good resources, whether it be locally produced resources, so Carrie's shop, or quality and best practices, which, Catherine, and evidence-based practice and national initiatives all bring in recruitment and retention ideas, partnerships from the National Forum. We'll find out about great activities. All of that kind of packages it, and we will bring it forward. We were asked by the legislature under or per SCR, Senate Concurrent Resolution 112, to form a working group and study the feasibility of joining the Nurse License Compact. It's a huge report. It's now 10-point font. No, it's 11-point font, but I'm looking at it, it should be larger. And also it's like 80-something pages. So there's a lot to unpack here. It's been a really large amount of work. I really want to commend Amy Ono, who's done an incredible job putting together the meetings and the minutes, updating the website, which you can see we have a picture of this, but we have all of our information. We were not required to put it pro Sunshine Law. We're not required to put this working group on a publicly available platform, but we chose to do it because we know that this is such an important topic to the public and to the nursing workforce. So all of our meetings are recorded. They're on YouTube. There's a whole channel. All of our resources by the meeting, each meeting, you can see all of the resources, and then the report will be public as well. But we're in the drafting phase. The long and the short of it is we're in a nursing workforce shortage. Not having access to nurses when you need them is a threat to public safety. It's a big problem. And when we don't have enough nurses, if there's licensure delays, that's what can cause delays in getting a nurse. So the question is the Nurse License Compact the right solution to bring nurses into our state when needed? There are other options. Temporary permit is an option, and the state is working on, and I'll talk about that in a second. State is working on bringing those temporary permit process back. Emergency proclamations, which we've had so many of over the past 3 years, is another option, but that should really be reserved to emergencies. It shouldn't be the status quo or general operating procedures. And then we have licensure, which generally takes under a month of time from application to license, pre-pandemic times, and it's returned. So right now the average is 24 days, which is 30 calendar days, 24 business days, 3 calendar days. But that during the pandemic, it was upwards of 60 days, which when you equate 60 business days to calendar days, that's about 3 months. So you can see that doesn't actually help get people in when you need them, right? You can't anticipate a shortage or a surge or a disaster, what have you. And it's been very difficult. Recruitment is very difficult. But when we look at, so that, and I think all of that, I think is pretty generally understood. When we look at recruitment, we then have missed recruitment because nurses can't tolerate waiting 3 months before they can get a job. They're working class people. So, you know, you might take the fastest job available to you, not the one that requires 3 months to get permission to work. Or, you know, that emergency has passed and the organization really can't tolerate to wait that much time. But then on the flip side, Carrie did a survey that went out. We had about 300 participants, very small survey, but we also saw a large interest, kind of surprising to me, but how much people were interested in getting the nurse license compact. And of the people who said they would be interested in getting a multi-state license if Hawaii authorized that, about half of them would consider taking their nursing hours elsewhere. So whether that be travel nursing or teaching out of state or what have you, they did see that as an option for them to be portable as well, to take their nursing services in many directions, not just into Hawaii. So with that, there's some pros and cons. So it might bring in, the nurse license compact might help with recruitment for travel nurses. It might help people who are trying to move here be able to move here faster. It might help with military spouses who don't get a license because it's so humbug, but maybe they would if they didn't have to go through the licensing process. But then it might also help people take their work elsewhere. So that's a balance from a workforce perspective, and that's where our focus really is at the center. It is one balance, is one side stronger than the other. From a disciplinary and regulatory perspective, what happens is that, and my analogy, I think I'm becoming famous for random analogies, but my analogy today with Anne was the Tootsie Roll Pop. So when you're a nurse, if you have a multi-state license, the license you hold is the Tootsie Roll part. It's the core. And that's only provided by the state that you live in. And then the candy part is the privilege to practice. And that's called the multi-state license, privilege to practice. And only your state can take away the core. If your state takes away the core, the whole candy is gone. But if you move to another, or you transport to another state, whether you're crossing state lines because you live on a state to state border, or you come into Hawaii if we were to join and work for a bit, you're working on the candy portion of this privilege. You're working on a privilege to practice. And Hawaii, if we had someone from Nebraska working here, something happened, they could investigate that privilege to practice, and that we could remove the privilege to practice, but they'd still have that core in Nebraska. If Nebraska is like, oh, what happened in Hawaii, I agree with that, they can take that license away. But if they don't agree with it, it's their own laws that they're really comparing infractions to. So there's a little, it works differently than how we work with licensure today. It also changes data. So right now, if you ever want to work as a nurse, whether you live out of state or in state, 100% of nurses have to register to the Board of Nursing. We know exactly who is interested in working in the state, maybe not interest, but has action, like has actually worked to be able to work in the state because they put in an application. We have all that information. We have all their past names, the school that they got their original license from. All of this information is known. The multi-state license, that wouldn't be known. So you can come into, if you're coming from Nebraska to Hawaii, you don't have to register. The remediation process in a lot of states is that it is a newer approach. Not many states, about 5 have done this, is they say, well, let's require the nurses to register that they're in the state. They either have to register, the employers have to collect a list, or a nurse is going to be asked to update their information and be notified that can be voluntary, and then the employer has to put a requirement. All of that, those processes don't exist in Hawaii. So if we wanted to do that, we'd have to create them. The Board of Nursing doesn't oversee or regulate employers right now. And so that would have to be new jurisdiction and new action that they would do. Also, when you require an employer to require an employee to do something, you are not going to get 100%. And so you still will have information loss. That's less important for the Center for Nursing than it is for regulatory. It's important for regulatory action because as I described, if nurses are moving around, they're working on their candy shell. If any discipline happens anywhere, everyone in the candy shell gets the alert, and then each state has to decide, like, what are we going to do? Do we care about this? Are we going to kick out the privileged practice for anyone who has a discipline? Are we going to look at it one by one? Is this person even in our state? Are we only going to address who's in our state, but we don't know who's in our state? So this does have implications for the regulatory and investigations tracking nurses. But from our work, we focus on our workforce research is nurses who are employed in Hawaii doing work in Hawaii. And so we may lose some of that data, but we would retain most of our data. And most important, we want to retain the research integrity that we do, the ownership over not only the analysis, but the study design. So for us, our focus is on recruitment and retention, adequate workforce. We see that there are some would help with retention, may impact, or it would help with recruitment, it may impact retention. On the regulatory side, there's a lot of changes. Other states have said it's fine, but our state doesn't quite act exactly like other states. And then we would not, yeah, Anne says no kidding. And then we would not have all of the data that is really necessary for investigation. And we will no longer have a data picture that we've had in the past if we adopt this, because employment data might show more nurses than licensure data, and then we'll have the workforce survey. So there will be just this foundational shift, and that happens. So we'll have to have a lot of questions about this. Normally we look at what the Center for Nursing does is normally we look at policy, and normally I don't have to ask questions because it's very clear, like should nurses work to the full extent of their education and practice? Yes, evidence says this. Yes, it's recommended for the workforce. In this case, I am unfortunately going to ask that you all read at least the executive summary, but please the whole report. I promise you it's great reading. But I'm going to ask you to read it so we can talk about it at the January meeting, which will be before the legislative session. I do expect that it'll be introduced, but I would like the board's opinion on this to be presented as what we give to the legislature, because in a lot of ways, I think that there are equal pros and cons. It's not for our regulatory interests. Our mandates are to look at recruitment and retention. And it's a challenging question. I also want to say that while I believe it's very clear that expedited access to nurses is critical. I don't think that's questionable, but we do know that there's other options on the table. There's temporary permits, as I said, which require DCCA staffing and kind of some process improvements that they're working on. Emergency proclamations, which there are some improvements that we identified that were put into place during the pandemic and probably should be made standardized. And then there's also just like automation of licensure and kind of infrastructure improvements that our DCCA is working on. All of that kind of might move us towards a better future. So that's a lot. I will ask your opinions. If you want to pop some popcorn, all of the meetings are posted on YouTube. It's a good time. And we're certainly happy to have any conversations. As that relates to the other initiatives going on in the state, The Center for Nursing did pay for a attorney by training to assist with DCCA to work on drafting the administrative rules. I talked to Leanne Tashima, the executive officer of the Board of Nursing, last week, Thursday, and she did let me know that they are moving along in the administrative rule process. The administrative rules are based off of SB 63. They focused on the workforce administration, or the DCCA professional vocational licensing administration process. So there was some challenges with the way it was written, which made it very cumbersome to implement. And with their workforce short, they were prioritizing full license applications over temporary permits because it was a little bit duplicative. So their effort is to only focus on the licensure by endorsement requirement that a nurse has an NCPD or nursing professional data and nursing, I don't know what it stands for.
NPDB, the National Practitioner Data Bank.
There's no C. NP, but I can't even say it. Nurse, I can't say it. The database of
yes,
nursing licensure
In the name, for the
and
name.
stuff for the nation.
professional licensure discipline is housed inside this data bank. So
Thank you very much, Carrie. I know what it is. I cannot, no acronym. So it requires, it's really hanging its hat on this requirement that in order to get a temporary permit, you need a license in good standing in another state. So that's the anchor point for the temporary permits. There would be two, I think they're working on two forms. So one is a licensure temporary permit that connects to licensure by endorsement, and then the other one would be only a temporary permit that lasts 120 days. So all of that is kind of same as SB 63. The difference is that it does have it does not have a time limit. So the bill would have had a 10, you have to be issued within 10 days, and the administrative rule right now doesn't have a time limit. The hope is that with the fees from the temporary permit and the improved process, the form that zeroes in on only the necessary information, that kind of like all of the infrastructure challenges are removed, and DCCA can issue these in like tip-top order. In the past, they issued them within 3 days, and most of them were issued same day. And then for Neighbor Island with facilities, actually, I think Renee Kona was mentioned, had like some organizations would fax over. So there was ways to make them accessible and timely in the past. So we know that that could happen in the future as well. So that's the hope that it would work. I also clarified, because I was uncertain the way the language was written. If a temporary permit is removed from nursing license by endorsement, would the Center for Nursing get license fees? But any permit issued by DCCA, then the Center for Nursing fee is assessed. So it would be like temporary permit with endorsement, we would get a fee, or if it's just a standalone temporary permit, we'd still get the fee. So we wouldn't have financial impact. There's no data for me to use to assess what potential impact would be. So I was pretty concerned about that. But there won't be a financial impact. So that concern is resolved. So that's temporary permit. Leanne was saying that she hopes that there will be a public version available by December. And then let's see. So, and I did mention we were able to bring on support to assist DCCA. We justified this as expenses because we have to support strategies to support recruitment and retention. If we don't have or if we have delays in recruitment because of delays in licensure, then that is something that we can address. And so we were happy to be able to provide that resource and assistance to DCCA. And she's been doing fantastic work. And then finally, the healthcare provider barriers practice to review law, healthcare provider barriers to practice law report review. Sorry, great title. has been a very fun initiative that started last January. We started doing the pre-work a little bit before. And when I mean fun, like there's a lot of laughter. It is a really great work group. Linda, as well as Roberta, are on this group. We have convened Hawaii Medical Association, Hawaii Association of Physician Assistants, Hawaii Association of Psychologists, HAPN, the Hawaii Association of Professional Nurses, HA, the Hawaii Association, the Hawaii affiliate of ACNM, which is the American College of Nurse Midwives, as well as the Center for Nursing, so Amy Ono and myself. We look at each law that mentions physician, doctor, nurse, whatever. We've identified 530 of them, and then each profession comments on their own scope of practice. Does our scope of practice allow this or not allow this? And then does this law agree or disagree? And if it disagrees, then we say this should be neutralized. So, like add everybody's name in, and if or just say provider instead of doctor, comma, nurse, comma, whatever. We've identified that of 180 statutes that we have read through, about half of them we do recommend some kind of recommendation. You can see that pie chart. So about half of them, we think that there should be neutralization, and this would enable professionals to practice to their scope of license and not have these barriers elsewhere. And an example, just an easy one, if you want one, is you can call time of death if you're a registered nurse, but not if you're a nurse practitioner. So if you were to call in and use your nurse practitioner license, you wouldn't be able to call in time of death. So you would, like, I only know my APRN license on the top of my head. So I'd have to like pull up my phone and find my RN license for the city and county to be like, oh, okay, yes, I will take that time from you. So that's an example. It would be better if we just said nurses pursuant to, or or if we, in a lot of instances where it's that specific, where it will list the individual licenses, then professions that are relatively newer, like PAs, won't be listed at all. And so then they should be added in, because why can't they call time of death, right? So that has been a really great working group. We did send the report to the legislature. They said that they would be working on it. We're following up. It would be a pretty huge omnibus bill. What we did is we gave them the report as of our findings in August. And we said we really respect the process of state departments, and we know that they need their own independent review, and they need to comment if there's federal laws or other things that disagree, and a larger undertaking than just our professional comments. And so we asked for the legislature's help on that. We just need to follow up. It may not happen this year. I think with respect to the wildfires on Maui, big things happen that need to be addressed. And I think we saw large infrastructure challenges. So this may be an initiative that gets picked up next year, and we still have more statutes to review. But it's been a very, very nice working group. And that brings us to, we're a little bit over, I'm sorry, but that brings us to the working session, which I don't know, Anne, I'll hand it back over to you.
So right now, Anne, if you want me to pull up the full document.
I think that's sure. So should we first go, now did you do your second one, the priorities, or did you just whip through that?
Oh, no, I didn't. Let me do the priorities.
Yeah, just whip through that.
Okay, so our board priorities,
Yeah, plenty of time.
yeah, just to review this really quickly. Well, most of this will be conversation.
Yeah, and we have a half hour left of the meeting.
So our board priorities, we had a very nice session, and thank you all for being in attendance. That was facilitated by Lily Bloom Domingo. So we have in our packet, which I have broken apart. In our packet, if you have it, we do have the write-up that Lily Bloom Domingo provided. And so what we haven't done, and part of it is because we have the SIM conference, the EVP conference, and launching the Good Jobs grant and writing this nurse license compact. So we haven't done a really deep dive look into the strategic planning. And so I'm actually thankful for that, because it lets us have a really nice conversation here today. So we started to see, and if you look at the end of the document, we started to see where the priorities were starting to gel. And those themes that were discussed were community-based clinical opportunities and continuing professional development, public health nursing, recruitment and retention, in particular, compensation and flexibility, increased faculty, workforce diversity, educational capacity, public education on wellness of nursing, the nursing workforce, leadership and mentorship training, and NCLEX access in Hawaii, particularly the Neighbor Islands. And so of those opportunities, then we had priorities started to come out, which were continuing priorities for, which some of them are continuing and some of them are emerging. So the continuing priorities, compensation, flexibility and wellness, increasing educational capacity, leadership and mentorship, and workforce diversity. And then we have emerging priorities, faculty and the NCLEX barriers, and then new opportunities, which is that public health leadership certificate that Gloria had talked about. And so what we are doing with educational capacity, wellness, and NCLEX, if I can just talk about those really quickly. One is, and we can do 3 slides forward, I think. So the wellness initiative, we have, this is a long, you can see that we're on a journey here. We're on number 4, moving into number 5. So Carrie's integrated wellness questions into the nursing workforce supply. We did an annotated bibliography of issues. Conveniently, Rose sent us during one of our board meetings while she was, I think, at HSCN's board meeting. She sent us the nurse staffing think tank, and it matched up almost 1-to-1 with the needs that we had identified on our own. So we started looking at that. We have a long list of activities that roll up to objectives and goals. So the next thing we need to do is launch this initiative. We need to find organizations that will do this work with us. We don't want the Center for Nursing to be the lone champion. This is, this should be community work. And so we need to move into kind of launching this initiative. So that's where we are with that. We also got a journal published on kind of this process, which is pretty novel. Nobody else is taking a statewide approach across the nation. And then actually the person I was able to present nationally at the AONL conference in May with the person who led the nurse staffing think tank. And she's really interested in doing this work. Her name is Katie Boston Leary. So she's also very interested in how we move this forward, because we're the only state who has chosen to do a statewide approach, which is exciting. And I commend you all, and I thank Rose for sending the think tank document to us, and Carrie and Bree have done a tremendous amount of really hard brain work on this, so thank you. With the NCLEX updates, we have kind of framed the issue. We got some great news from Carrie 2 months ago that NCSBN is working on, they're aware, and they are working on this issue. So right now, the only place to get to take the NCLEX LN or PN or RN is on Oahu. But NCSBN is working on the making an online proctor option. We have had challenges with online proctor options for other certified tests. So there has been an interest to make sure that our broadband capacity meets NCSBN's thresholds or working with them. So there would be a great opportunity for partnership there. I was actually just on the Rural Health Advocacy and Research Strategy, the Rural Health Strategy and Research Advisory Council earlier today, and they're focusing on transportation. And I said, could this be a priority within transportation? Because it inhibits the workforce development. And then we are, and then we have just a need to talk about what else we're doing, or where you all want us to go in terms of these strategic plans. In terms of educational capacity, we are also doing, Bree has been working on looking at tools to bring in so that the health, all of the health requirements for students then has a model and system that it's standardized and more usable than the current model, which is pretty laborious. And so that should help with capacity. And we're also working, she uses a lot of data to help identify where there's clinical placements gaps and opportunities for expansion. So that work is undergoing, and Leanne is working on some faculty, because we started getting faculty funding for faculty training. So thinking about how we can build that. But we need to have kind of, I think, more input from you all about what we really can be doing or how to prioritize within these three. So I'm going to stop talking.
I've gone back to the identified priority.
So off the top of my head, the emerging priority of increasing faculty certainly goes back to the continuing priority of increasing educational capacity. So the clinical placements is certainly one. Another thing that is another comma, including clinical placements, is also strengthening SIM.
Okay.
Because that also can do the clinical placement side, but cannot teach without teachers. So that is those two seem, it requires the emerging to go up to the continuing to support number two.
Anne, can I ask you a question on that?
What strengthening the SIM? Oh yeah. Well, yeah, Carrie.
About the strengthening SIM, are you talking about, I don't know, expanding access to education to certify SIM instructors, or what do you have a specific sort of vision for that?
Yeah, it requires it to be evidence-based so that it will stand on its own, but you need to, the pedagogy needs to be certified. It needs to be linked to course objectives, to clinical course objectives with, you know, demonstrable outcomes, behavioral outcomes. So, you know, I think we have a really good foundation, but it needs to be ratcheted up to the next level to be much more to be very clearly connected to their progress. Because if you go to clinical, you know what happens?
What?
Get what you get.
Right.
You know, so when we go to SIM, we take cases that new grads are likely to encounter and drill them there. So but we need to, you know, make sure that our scenarios and our outcomes and our debriefings, you know, I'm going to channel Lori Wong. Make sure those are really all connected and synced up to the current evidence of the time for those things. So I think we're well on our way, and having that conference, I hope, will help. And we do need certification. I don't think we can say we're doing a great job if we don't have certified faculty and lab people who are fully aware and akamai and all the necessary requirements.
That's helpful. Thank you.
So this is Clem. In terms of compensation, I went to the American Nursing Leadership Conference about a week and a half ago, and there is a Nurse Faculty Shortage Reduction Act, S2815, to help address the pay gap between clinical and faculty positions.
This is federal?
Yeah, this is something being pushed by HSCN. When we went to the Capitol, we proposed that our congressional delegation support this. We also asked for their support of the Precept Nurses Act, and this is to recruit and retain nurse preceptors, nurse who provide at least 200 clinical preceptor hours to student nurses, and APRN candidates have 2,000 tax credits. So I think our tax credit right now is only mainly for NP students, but this would be for the generalist students as well. So I think it would be good to be following those up.
Could you provide those? Could you email us the, oh wait,
Mhm.
Carrie's just Googling in real time.
Thank you, Gary.
I think if you have the policy brief from AACN, that would be helpful, to track.
Mhm, mhm. Okay, I'll ask Rachel Stevenson.
Okay, great.
I mean, there would be some way if you could compensate, and this runs into union problems. Because Maui Nurses Scholarship Foundation offered to pay preceptors money. And that's a union problem. So if we had staff people who we could compensate. So that they would be willing. You know, the problem is, would they be doing it on their day off? Or it would be part of their job, regular. So that compensation thing does come into be a little bit of a problem. If they're an employee of the university and they get compensated from the lecturer pay up to the pay they earn when they're practicing as a nurse, that's the gap the bill would fill. Is that right? I mean, it's tricky. When you get in the weeds, it gets trickier.
I think I'd have to look, I'd have to look at the briefing to have more of the details.
I think, Clem, I wonder, and the Center for Nursing hasn't done a lot of federal advocacy for state issues. But recently, Carrie, I don't know if you can remember which state it was. I think it was Tennessee put out, they gave a letter to their congressional delegate and they sent it out to the National Forum about, I think, the Skills Act.
Yeah.
You know, so they did leverage their knowledge and expertise to inform. And you know, we do a little bit of that work, but not a whole bunch. Our focus tends to be state and local partnerships.
Mhm.
And I bring this up because, you know, and I know just because being within the School of Nursing, UH does have federal priorities but academic priorities and workforce priorities are different. They're different, right? We have different lenses. So
Mhm.
is it something that the advisory board thinks is advisable to spend more time on federal policy? Because it can be a lot, and I think I want to know, you know, is it if we are creating information briefs that are relevant, you know, we create a lot of information briefs. So do we do more that are relevant to these federal issues as well as state issues? And would that help inform these strategies on a federal level as well as a state level that might benefit Hawaii?
Well, that's the linchpin. Does it benefit?
Yeah,
Does it benefit our goals of recruitment and increasing faculty and educational capacity?
It could. Right now, we're one of the lowest. We're one of the 3 states that get the least amount of Title VIII funding in the nation. So because a lot of times there's other things that are prioritized, and then we can't, when we apply we don't get the grants, or we don't apply because they don't fit. So, you know, it could help.
Yeah, I did ask about that because when I looked at the data in terms of the HRSA funding, we had only over 20,000 for 2020, and for 2021 they had only over 400,000. That was HRSA type of grant funds that were awarded to Hawaii, but none to the UH as far as I know. Laurie did write a SIM grant last year, but did not get funded, even if the rating was really high. So I questioned whether or not the lack of funding was due to not enough funding, or why is it that if it was so highly rated that she did not get funded? And why is it that Hawaii has had
That
such?
has happened, like for the federal.
sorry?
One thing that has happened, so hopefully we'll see better applicability or better scoring next year, is for the workforce diversity. I worked with UH system to get Native Hawaiian and Pacific Islanders serving states prioritized in the workforce diversity grant. And so that should get a bigger score next year for any of the schools in Hawaii who apply. So so there is some outcome that you can get from federal advocacy that doesn't have to be like a brand new act. It could be report language that prioritizes things that make that are unique to Hawaii.
Yeah, and Senator Schutz's office actually said that if we want certain language to be included, to let them know.
So I guess the question is, and maybe from other board members as well, is we have generally done programs, focused research, and state strategies, state policy strategies. That's where our work is focused. And from these priorities, is there room or a place for federal initiatives as well? And we don't have to know exactly what that is today, but if it's worthwhile, then we can start paying attention to that in a more considerate way.
If it's worthwhile. But of course, it takes,
Yeah.
it takes work to know if it's worthwhile. So you already have to tell yourself in the beginning, it's worth looking. Sooner or later, I'll find something.
Yeah.
So it wouldn't have been worth looking up 20 weeks before this.
No.
But there may be a time in the next 20 weeks that you could give it a run.
That's fair.
And you guys know your bandwidth. I mean, it's like staffing at the hospital. You just can only do how much you can do, and it really impacts the results. So you don't want to spread yourself too thin. All right, does that take us? Is there any other comments on the priorities?
I think I have a question about or maybe a comment about the faculty piece, just as an addition. So what we're aiming to do is we're about to launch a continuing education, I guess a license, you could say, for Nurse Tim, which is, they've got a large number of online trainings, and we will be able to cover the costs for every school of nursing in our state for full-time, part-time, and graduate students. Seems very robust to me. So that will be made available to all faculty, even lecturers. So hopefully that will help with kind of point in time, oh man, I need, I need help with this, or help with professional development or remediation, or just general good development. And there are CEs with that, so hopefully that will also support faculty needs for continuing education or lifelong learning efforts. And then we're working with, we worked with Connecticut Center for Nursing. They had a 30-hour, 3-week training for new lecturers. We're also talking to Health Impact, which is the California Center for Nursing. They have a different 30-hour training. It's more intensive, and it hits a higher level of learning. So there's kind of like a 101, and then like a knows what, knows when, is what Health Impact does. It's associated with the Benner Institute, of Patricia Benner. So I think there is some work at play, but I don't know if Gloria can comment, but I think one question that I have for the board is, we are very good at working with our partners, and we work really hard at getting to the areas where nursing is more dispersed. And I want to make sure that our efforts are reaching out to the farthest corridors of nursing and making sure that all nurses are getting impacted by the services of the summer. So if there's ways that we can broaden our work or even maybe make it more targeted, please do let us know.
Cool. All right, so it's 6:51, we're right on time. Other business.
Get that. Can you
Oh.
try again?
Siri is eavesdropping on me. I didn't ask you anything. So for the advisory board schedule for next year, I think the global thing to note is we're asking to move the meeting days from Tuesday to Wednesday. So you can see this next year's calendar are all on Wednesdays. So would that be okay for you guys? We'd like to have a nod or a thumbs down on this one.
It's only 4 days. Yeah.
Yeah, it's every quarter, each
Yeah.
quarter.
Exactly the same as this year, except bumped 1 day.
Yeah, it's 4
So-
Wednesday meetings and then 1 Saturday meeting.
Are you gonna
Okay.
put a motion to approve?
Okay, I'd like to make a motion to approve this change.
I'll second.
Only thing is the first one on January 17 is also the legislative opening, or does that not matter?
Well, the legislative opening is the day, so it doesn't,
Oh.
I mean, kind of procedurally,
You'll just be tired.
yeah.
What's new?
What is new?
Okay, so I saw all the thumbs up on there. Does that count formally?
Well, I think that happened
Pre
before
the motion?
But
Okay, better shoot me those thumbs up again so that we're even here.
and Carrie has become the procedure master, and she now
So
doesn't
I
have
got 1,
Yeah.
2.
I was gonna say, you need a second first.
Yeah,
Oh,
I did
okay,
a
I
second. A motion, a second, count your vote. You don't have to do a roll call vote.
Okay, well, I see 6 thumbs up, so that should do it. I'll thumb up. Okay, and I'd like to make one other motion, which is to add something to this agenda, which is just to review this. Could I have a second to this motion?
So the motion is to review the mission and the vision statement update.
That's on your screen now.
So there needs to be a motion to review it.
Yeah, it's Herculeana to add it, but she's gotta make a motion and it's gotta be approved.
Correct.
Nobody wants, can we get a second?
This is Clem, I second the motion.
Thank you. Okay, we'll have a read of this here. This is our vision statement.
So if you all recall from the strategic planning meeting, we had the mission and vision committee proposed changes, and then the comment was, can we have a grammar check because there's a verb tense disagreement, but it was not a substantive change, it was a
Wordsmithing.
oh, it was just like one last grammar change. So the chair and the vice chair met with Bree and I, and we addressed the grammar.
And the grammar's only really relevant to the mission statement.
So the vision had no request for changes. The mission, the grammar check, in order to do that, you kind of had to change all of the grammar one way or all of the verbs one way or all of the verbs the other way. So we gave you both of those options. So substantively, there should be no difference. It's just to engage in research, to engage in the promotion, to engage in the cultivation, or engage in research, promote best practices, cultivate a diverse. So it's stylistically which of the two proposed options is preferred.
Rose says 2.
Oh,
Jeanette
And that
says
says
2.
2.
Carrie says too. See, I knew that was the one everybody was gonna.
Okay. Well, I think. that's
Those are
good.
the things everybody had questions. Okay, we've got
Like
Gloria with two,
consensus.
Arthur with two, Renee with two.
Okay, you got it.
Okay. You're gonna make a motion to approve now?
Okay, I'm gonna make a motion to approve it now. Can I have a second?
I'll second. This is Jeanette.
Yeah,
And,
okay,
and to be clear, the motion is to approve option B.
option B. The motion to approve option B of the mission statement has been approved. Mahalo. All right, well,
And I love you and Robert's rules.
yeah, yeah, me, I usually, no, I'm not gonna say that. But thank you for your support in this, it's very good, and, thank you guys so much for, lending your time to this. How great is this Center for Nursing group here? Laura and Bree and all the guys, are they awesome or what? So, and so are you, I know you guys are the busiest people on your block. And I really appreciate your brains and your heart, and, thanks for coming, and we see you when we see you. Happy holidays.
Good to see you, Julio.
Happy holidays.
Aloha.
Thanks,
Aloha.
everyone.
Aloha.
Return. 6:57, I like.